There has certainly been a lot of discussion about monkeypox in the news, a lot of fear and uncertainty out there. So I was asked to look into it. I knew nothing whatsoever about this disease until I started looking at it today. And I am struggling valiantly to avoid putting any amusing graphics in because of the funny name. Sorry about that. This presentation is going to go over the incidence of monkeypox. We'll do a quick review of the diagnosis of monkeypox and the signs and symptoms associated with it, and then we'll talk about whatever precautions EMS should be taking, if any at all. So first, the incidence in the United States. Currently, there are 9 cases as of May 26th. This morning, when I first started researching it, there was 1 case. By noon, there were 4 known cases, and now there are 9. So chances are we're going to learn of some more cases, and it's going to sound like a rapidly spreading infection, but you should be aware that it is very difficult to transmit this disease. It requires close physical contact with somebody who already has it. So you're not going to catch this in the line at the grocery store. You have to have that close physical contact. Back in November of 21, there was 1 case that was traced back to somebody who had traveled to Nigeria and contracted it there and then returned to the U.S. with the infection. A few months earlier, the same thing happened. Somebody traveled to Nigeria, contracted monkeypox, and then came back to the U.S. They took 2 airplanes filled with a total of 200 people. All 200 of those people were tracked and monitored for a full 3 weeks, and there was not 1 infection as a result of being on the same plane as somebody who had monkeypox. The big outbreak of monkeypox in the U.S. happened in 2003. There were about 47 cases. They were all in the Midwest: Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin. What happened is a shipment of animals, including a large number of rodents, came in from Africa to Texas, and then a portion of those animals were sent up to a facility in Illinois, and they were housed in a cage close to 2 prairie dogs. The 2 prairie dogs were sold as pets, and all 47 cases can be traced to physical contact with those prairie dogs. So clinically, what is the doctor looking for when they're trying to decide if an infection is monkeypox? It looks very similar to smallpox. The major difference is the presence of swollen lymph nodes, and they can be just in the area of infection, or it can be body-wide. And it usually occurs around the time of the onset of fever, which is an early stage of the progression of the disease. The rash that's associated with monkeypox consists of vesicles or pustules. They're deep-seated. They go through the cutaneous level of the skin. They are firm or hard, well-defined, well-circumscribed round lesions, and they progress over time to become scabs, and then they dry up and flake off. The symptoms on the onset are usually fever, chills, the rash, or new enlarged lymph nodes. At the onset, there also may be perianal or genital lesions, and in those cases, sometimes there's no fever reported, just the lesions. The rash that's associated with monkeypox can be confused with other diseases such as syphilis, herpes, chancroid, or varicella zoster. A high index of suspicion for monkeypox should be there, though, when you're evaluating people with that rash, particularly for men who report sexual contact with other men and who present with lesions in the genital or perianal area, or for individuals reporting a significant travel history in the month before the illness onset, or contact with a suspected or confirmed case of monkeypox. The disease usually progresses through 4 stages. The incubation period can average between 7 and 14 days, and it can range anywhere from 5 to 21 days. And this period, there are no symptoms. They've simply been exposed, and the disease is incubating. The prodrome is the early onset of symptoms. The person may be contagious during this stage, but they are not as contagious as they are once the lesions develop. The prodrome period is 1 to 2 days before the onset of rash. And the first symptoms are generally fever, malaise, headache, sore throat, cough, or swollen lymph nodes. Once the rash develops, that period can last 15 to 27 days, and we'll go over the various stages of rash development in a minute. And then once the rash is gone, they enter the resolve stage, which is after all the scabs have fallen off, and at this point they're no longer contagious. Back to that rash stage, in the ethynum, which is the first onset of a rash, The lesions will develop usually in the mouth and on the tongue. That lesion becomes a macular rash, which is a flat rash, starting on the face, spreading to the arms and legs, and then to the hands and feet, including the palms and soles. The rash typically will spread to all parts of the body within 24 hours, becoming most concentrated on the face, arms, and legs. By day 3, the macular rash becomes papular, which just means that the lesions are now raised and they're beginning to fill with fluid. And a couple of days later, the lesions are vesicular. They are raised, they're large, and they're filled with clear fluid. That stage will last 1 to 2 days, and then by the 6th or 7th day, the lesions become pustular. They're filled with opaque fluid, and the pustules will remain for about 5 to 7 days before they begin to crust over. By the end of the 2nd week, those pustules have crusted and scabbed over, and the scabs are going to stay around for about a week before they begin to flake off. The precautions that you would take as an EMS provider that is transporting somebody known to have monkeypox is to use all the standard precautions we use with all patients. You're going to want to add a gown, wear your gloves, wear eye protection, wear an N95 face mask. And the reason for this is once the scabs begin to dry up and flake off, those little flakes can become somewhat airborne and move around, and they can fly over and get on your clothing. So you definitely want to wear that gown and have a barrier between you and the patient at all times. Here are some visual examples of the lesions, what they appear like in various stages. Most, if not all, transmission of this disease is done through intimate contact between two people. There has to be physical contact. It's real easy to take the appropriate precautions and go about our job without being particularly concerned. Thanks for paying attention. I will continue to pay attention to the story, and if anything changes or we get new data, I'll make sure you guys all find out.